Hello and welcome to the print video. I am Sumi Sukanya Datta, and in this special broadcast, I bring to you a report on the new guidelines for ICU admissions and why they are important. So what are these guidelines? Critically ill patients should not be admitted in the intensive care units or ICU if they or their next of kin refuse the intensive treatment. Also, those who have any disease with a treatment limitation plan indicating the ICU interventions will not provide clinical benefit to them should not be offered such treatment. These are some of the important recommendations from the first ever guidelines by the Union Health Ministry on ICU admission and discharge criteria that were released last month. But these guidelines, adopted for India after studying similar norms around the world, are only advisory in nature and not binding on hospitals or doctors. The recommendations have been prepared by the critical care specialists from the government and private sectors. And they say that anyone with a living will or advanced medical directive or AMD against ICU care should not be administered intensive care. Also, those who do not benefit from aggressive care should be discharged. In 2018, the Supreme Court had passed a landmark judgment upholding the legality of withholding or withdrawing life-supporting medical intervention from terminally ill patients. A living will allows a person to choose how she or he dies under certain medical conditions. Dr. Raj K. Mani, ICU specialist who was in the committee which has framed the guidelines, told us that the latest guidelines are crucial as ICU care is a valuable, expensive and scarce resource. He said that such settings must be used with due care and without best practices guidelines, utilization of the ICU can be arbitrary and subject to misuse. Dr. Mani emphasized that in many cases the suffering of terminally sick patients may only be aggravated and prolonged by life-sustaining treatments as they die lonely in medicalized environment. And this happens when they need their family and familiar environment around them. The guidelines say that the patients who need ICU care are those with altered levels of consciousness with recent onset of shock and irregular heartbeat. This category also includes those with acute illnesses requiring intensive monitoring or organ support. Also, patients with medical conditions or disease with anticipation of deterioration, those who have experienced any major intraoperative complication, or those who have undergone a major surgery should be given ICU care. But terminally ill patients with a medical judgment of futility should not be offered ICU interventions. The exclusion criteria also includes low priority patients in cases of pandemic or disaster situation where there are resource limitations. The guidelines suggest that the patient should be immediately discharged from ICU in case of return of physiological aberrations to near normal or baseline status. This should also be followed in cases of treatment limiting decision when a patient or family wants only palliative care. The advisory also specifies the minimum standard of monitoring required while awaiting an ICU bed and minimum stabilization required before transferring the patient to ICU. According to Dr. Mani, guidelines were necessitated as ICU care in several cases imposed unjustifiable emotional as well as financial burdens on families of patients. There is another intended benefit from the new suggestions. Since ICU beds may be filled with those who are for terminal care, many patients with curable ailments are sometimes denied life-saving care. The latest recommendation also define who can provide ICU care. As per the guidelines, a specialist who has specific training, certification and experience in managing critically patient in an ICU is an intensivist or critical care specialist. But in case of doctors not having the requisite qualifications or training, those with at least 3 years of experience in intensive care after MBBS can also work as an ICU doctor. Dr. Dhruva Chaudhary, a critical care specialist from Haryana who is also behind framing the guidelines, said that this was particularly important for Tier 2 and 3 cities. He told us that looking at the ground reality, experience has been given due weightage to define intensivist so that even Mufassil towns can get emergency and intensive care. That's all we have in this episode. Thank you for watching.